Post-root canal treatment. Instruction. After a root canal, RCT, it is normal to experience some tenderness and sensitivity for a few days. Proper care is required to promote healing, manage discomfort, and protect the treated tooth until a permanent restoration can be placed. Immediate post-operative care after root canal treatment. Avoid all food and beverages until the numbness from the local anesthetic has completely worn off. This prevents you from accidentally biting your cheek, lip, or tongue. Pain and discomfort after RCT is absolutely normal. Take all prescribed antibiotics as directed by your dentist even if you feel better. Repeat painkiller as required. Use a cold compress. If there is any swelling or discomfort, apply a cold pack to the cheek outside the treated tooth. Use for 10 to 15 minutes at a time, several times a day. Or take 1 glass of chilled water, take a sip into your mouth and hold it on the treated tooth side, keep it for few seconds and drink or spit it out. Repeat the process several times. Rinse with warm salt water. If there is no tenderness or pain, a warm salt water rinse, a half teaspoon of salt in 1 glass of warm water, can soothe irritated gums and help keep the area clean. Use this rinse 6 to 8 times a day for faster recovery for 5 to 6 days. Elevate your head. To help minimize swelling, keep your head elevated by using an extra pillow while resting or sleeping for the first few nights. Avoid strenuous activity. Refrain from heavy exercise or other strenuous activities for a day or two after the procedure to aid up in the healing process. Diet and eating guidelines. Chew on the opposite side. Protect your tooth, especially while it has a temporary filling, by chewing on the side of your mouth opposite to the treated tooth. Stick to soft foods. For the first few days, eat soft, easy-to-chew foods that require minimal pressure and chewing. Avoid certain foods. Do not eat anything that could damage the temporary filling or cause pain. Avoid hard foods, nuts, ice, crunchy foods, chips, pretzels, and sticky or chewy foods, caramel, gum. Limit temperature extremes. Avoid very hot or very cold foods and drinks, as your tooth may be sensitive to temperature during recovery. Do not smoke or drink alcohol. Tobacco can significantly slow down healing, and alcohol can interfere with medications and the healing process. Oral hygiene measures. Brush and floss gently. Continue your normal oral hygiene routine, but be gentle when cleaning the treated tooth. Use a soft bristled toothbrush and take care not to dislodge the temporary filling while flossing. Floss with care. When flossing around a temporary filling, gently pull the floss out from the side instead of pulling it straight up, which could dislodge the filling. Schedule a follow-up. The root canal procedure leaves the tooth structure weakened. A follow-up appointment is necessary for your dentist to place a permanent filling or a protective crown to prevent the tooth from cracking or fracturing. Do not delay the permanent restoration. A temporary filling is not strong enough for long-term use. If not properly restored, the treated tooth is at high risk for future infection and fracture. Contact your dentist immediately if you experience any of the following symptoms. Severe pain or pressure that persists or worsens several days after the procedure. Visible swelling inside or outside your mouth. An uneven bite that feels off after your temporary filling was placed. The temporary filling comes out completely. It is normal for small pieces to flake off. Signs of infection, such as fever or pus.